Hi, welcome back to Rohrich Knows podcast, helping you become a better and more informed you. Let's talk about one of my favorite topics, rhinoplasty. I get a lot of questions about how can I have a great tip. So let's dive into what makes a perfect tip in rhinoplasty. And it's probably one of the hardest things to do, that along with getting a nice dorsum. So what makes a perfect tip in rhinoplasty? And I get that question all the time. And really, it's all about consistency and shaping the nose, shaping the tip, and giving you a nice, natural-looking result. And really, when you look at it, and I'm going to talk a little bit about the science, but also about the technique, and you tension it to get the tip shaping exactly where you want it. Because we used to just do Kayumono struts. These are these little grafts that go into the base of the nose, and they worked okay, but they were not consistent. So basically, we've evolved in our thoughts on tip support, and really it's evolved from the rationale of using Kayumono struts, which are great if you have good cartilage grafts or cartilage that's native cartilage right here, and that is okay if you don't need to change the rotation or the projection at all. But if you need anything more than that, these struts don't work well. But in a patient like this, she's ideal for a Kayumono strut because she's got good projection and good rotation, but she's very deviated. So what you do is you fix the deviation, you correct the asymmetry, and you put in a Kayumono strut, and voila, you get a beautiful shape and contour of her nose and her tip, and it looks elegant and it looks natural. This is a great technique to use for a deviated nose that's got strong lower lateral cartilage. And these are all long-term results on patients with a Kayumono strut. It looks great, in patients that are very selective, on patients that didn't need a lot of change in rotation or tip projection. So they look really good long-term, and even after a facelift, she still continues to look good in her nose and her tip projection, and she looks elegant. But if you want to do anything but maintain tip projection, you need something stronger. And that something stronger is called a septal extension graft. And that's when you have to evolve from a strut to a septal extension graft. And that's really what we've talked about a lot in the last 10 years, and really amplified a lot in the last 5 years on how that's changed how we do tip shaping, because it's fixed and yet mobile. And let me go into a deep dive on that, what that means. And really what that means is that you're taking a piece of cartilage from your septum, that's that midline structure, and you're pivoting it on that fixed area, and then you're tensioning it along the lower laterals. And that gives you incredible contour consistency for both tip shaping and septal rotation. And we've written a lot about this in our academic journals to show why it's superior. And this just shows how it's done in the operating room. And this is not to, overdo it, but basically just show you how powerful this technique is to reshape your nose based upon not only a fixed but mobile structure, but also the tip shaping, and gives you all the different types of sutures that you're going to use to reshape the tip and give you some really nice alar contouring and tensioning of your tip. And I think this is the ideal tip shape that everyone should have if you want to look good and also attain what you want to do, which is a straight lateral crura that's everted, and at one side being higher than the other, and make it diamond shaped. And so you have a patient like this that's got a very bulbous tip, droopy nasal dorsum, and you want to reshape it and give you a consistent elevation and rotation. Ideal for a septal extension graft, which is shown here in a diagram. And so what you're doing is you're putting the tip shaping together, you're doing a septal extension graft, and then you're actually closing the dead space. And then here she is a couple years post-op, where she's got nice tip shaping, the diamond tip shape, her dorsum is beautiful, and we've reshaped her dorsum. We've given her dorsal aesthetic lines a much more improved contour, and we've given her tip nice elegance as well. And I think that's really what you want to do. You want to give somebody a natural, elegant shape to their nose and to their tip. And then you can even do that in a very thick-skinned patient. like this lady that's got a very thick nose, thick skin, a big dorsal hump, and you can transform these patients from this really kind of dorsal hump look with a thick skin tip and really tension not only their tip but their dorsum. And using that same technique, you can really refine that nose so well. And you can use these same sutures and tip shaping and really contour that nose. So you're pushing it up, you're doing the dead space closure like we talked about, and you're closing that area up. And again, I'm just showing you how we do these dead space closure techniques. And here she is at 2.5 years. She has transformed. She is a beautiful woman. Now her nose matches her beautiful face. She's got an elegant looking dorsum and tip and really shape, and she wanted a really distinct shaped nose, and it's really beautiful. It matches her face, it matches her personality, and really, it's really what you want. You want an elegant looking nose to match the elegant face. And you can do the same on a thin-skinned patient. So this is a very versatile patient technique where you have a patient with very thin skin, a long nose that's droopy, and you can do the same exact thing. You can provide that structure to the tip with a septal extension graft, and you can reshape the tip and remake it and do finesse things like a butterfly graft. And here she is elegantly at 2 years, where her dorsum's beautiful, her tip is now straighter, it's softer, it's smaller, it's really elegant, that matches her beautiful face and contour. And the most important thing, it looks natural. That's the beauty of a great rhinoplasty. It looks natural, it looks like it belongs to their face. And it's really like patients come in today and she said, you know what, I now have the nose that I really should have been born with, because that's what matches my face and my life and my personality. And certainly you see that in this patient. So that's a very brief overview of what makes a perfect tip. A perfect tip is really the hallmark of an elegantly done rhinoplasty based upon the surgeon's expertise, experience, and exceptional results, the 3 E's. So really, when you're looking to do a rhinoplasty, make sure you find someone who's really an experienced rhinoplasty surgeon, either a board-certified plastic surgeon with expertise in rhinoplasty or a facial plastic surgeon that's an otolaryngologist that has expertise in rhinoplasty, because rhinoplasty is the most challenging procedure we do in all of cosmetic surgery. So know before you go, every nose is different. So choose wisely, and this hopefully will help you become a better, more informed you, so you can get a better nose and a better you. Till next time, enjoy.